Omicron cases across India continue to surge. Tally is at 781. Maharashtra is 167 cases. West Bengal 11. Let's take a look at ground reports coming in.
COVID-19 cases are on the rise in West Bengal, and as of December 28th, the number of COVID-19 cases stands at 752, while a day earlier than that, it was at close to 430 cases. Despite the fact that the cases are rising, the West Bengal government has chosen to lift the night curfew that was there in terms of the restrictions, but it could be that after the 1st of Jan, the restrictions would again be in place, considering the fact that the cases are on the rise. The restrictions were lifted keeping in mind the Christmas and New Year season, but because cases are rising, the West Bengal government is keeping an eye on the situation across the state. With camera person Kiranjit Das, Prema Rajam in Kolkata for India Today.
COVID-19 cases in the state of Tamil Nadu are seeing a rise. On December 28, 619 COVID-19 cases were reported and 11 new cases of Omicron were also confirmed. Now the state tally as far as Omicron is concerned is around 45, of which 2 cases have been cross-verified to Puducherry and Kerala. With New Year around the corner, we're seeing that new restrictions have been put into place by the Chennai police. We're being told that in the beach there will not be any kind of New Year celebration that will be allowed. We're being told that on the day of New Year and the New Year Eve, a lot of restrictions will be put into place. No public gathering will be allowed. Even residential associations have been instructed not to have any kind of gathering in their apartments or societies. We're already seeing at the Besanagar beach, where we're currently at, barricades have been brought in here. Even here, people will not be allowed to celebrate New Year from 9 p.m. onwards. With COVID-19 numbers increasing, these are the measures that people should be using and ensuring they follow to prevent the spread of the pandemic. With camera person Daniel from Chennai, this is Akshana for India Today.
We can see a lot of lapses and irresponsible behavior that can be seen. You can see how people still on the road, not maintaining social distancing, not wearing masks also. And this is extremely dangerous, because the third wave of COVID has begun in the state. However, till now, no cases of Omicron has been found in Bihar, but the sudden spurt in COVID cases is extremely serious, and people who are on the roads, who are on the streets, they need to understand that this is extremely dangerous, and this kind of irresponsible behavior will only lead to some sort of a corona explosion in Bihar, and the cases could rise in days to come if the people do not behave responsibly and follow the COVID protocols. With camera person Nadeem Alam, this is Rohit Singh in Patna for India Today.
With less than a week to go before the vaccination drive opens for 15 to 18-year-olds in India, preparations are going on in full swing across the states, from Maharashtra to Tamil Nadu to Delhi. Here is how all the states are gearing up to administer doses to teens.
India is gearing up to vaccinate its teenagers. The vaccination drive for 15 to 18 years old will start on 3rd January. They can only be administered the Covaxin shot. The beneficiaries will have to book their slot on CoWIN website. With less than 1 week to go, all states in India are preparing to vaccinate its young population, especially in view of the anticipated surge in Omicron infections. In Delhi, the eligible children will be vaccinated at the existing centres. They will be administered jabs at government schools and government and private hospitals. In Maharashtra, the number of eligible teenagers for the vaccine is being ascertained. 3.7% of the state's population is likely to be vaccinated. The state of Tamil Nadu is also gearing up to inoculate 33.2 lakh children. Assam's state departments and district administration are planning to administer vaccines to 18.25 lakh teenagers. And in Haryana, nearly 16 lakh eligible children will receive their first jab. The state government is collecting data on all school-going children. Children who were vaccinated in the trial phase have received their vaccine certificates.
जो पहला डोज लिया तब मुझे थोड़ा सा तो डर लग रहा था कि वैक्सीन लेने के बाद क्या होगा, क्योंकि ट्रायल में ले रहे थे, बट वैक्सीन लेने के बाद कुछ प्रॉब्लम्स नहीं आए हमें और कुछ भी जो हमें था वो कुछ हुआ नहीं हमें।
ये घोषणा जो प्रधानमंत्री जी ने की है वो उसके बैकड्रॉप में मैं उन सभी लोगों को कॉन्ग्रेचुलेट करना चाहूँगा जो बच्चों ने और उनके पेरेंट्स ने ये वैक्सीन की ट्रायल लेने की हिम्मत की, और आज उनकी हिम्मत की भरोसे ही ये ट्रायल सक्सेसफुल होने के बाद बाकी सभी बच्चों के लिए ये वैक्सीन ओपन की जा रही है।
With Omicron cases on the rise, India is leaving nothing to chance by opening up vaccination to the younger population. Bureau Report, India Today.
Doctors have wondered at the reasons behind long COVID and why it affects so many organs in the body. A breakthrough study that has been done on COVID dead in the US now tells us that COVID stays in the human body for months after recovery. Here is a news report.
2 years into the pandemic and countless cases of people suffering from long COVID. Some had difficulties in getting back to a normal life months after recovery. Scientists today have found some answers behind the extended illness. Scientists at the US National Institute of Health said they found that the virus is capable of replicating in human cells well beyond the respiratory tract in the human body. Because SARS-CoV-2 spreads within days from the airways to the heart, brain and almost every organ in the body, where it may stay for months. Studies say the delayed viral clearance is what leads to persistent symptoms of long COVID. Scientists have detected persistent SARS-CoV-2 RNA in the brain for 230 days. Infection of the lungs could lead to virus spreading in the bloodstream or viremia in mild cases. Results were based on samples taken from autopsies of 44 COVID dead patients. Indian medical experts have called the study a breakthrough in understanding long COVID.
It means it is not only limited to respiratory tract, the lungs. It could go into any part of the body, which includes heart, brain, etc. And all these long COVID symptoms like neuropsychiatric manifestations, seizures, brain fog, etc., they can all be found.
We have seen that even after recovery from COVID, the patients continue to have different symptoms. They were never fully comfortable. They continue to have symptoms. So there was always a concern that probably COVID virus has caused permanent damage to the organs, or it is due to the persistence of the organs.
Less viral clearance outside the lungs is related to weak immune response in the body in early stages.
ऑटोप्सी स्टडीज़ में ये पाया गया कि कई बार ये इन्फेक्शन करीब मोर देन 290 डेज तक वायरस, एक्टिव वायरस या रेप्लिकेटिंग वायरस बॉडी के अंदर था। तो ये दर्शाता है कि इन्फेक्शन इमीडिएटली आप दवाई दें और तुरंत से ठीक हो जाए, ऐसा नहीं है, ये मिथ है। तो इसलिए, और ये नहीं है कि हर केस के अंदर ये वायरल इन्फेक्शन जो है इतना लंबा चलेगा।
The results of the study, published in the science journal Nature, is yet to be peer-reviewed. But doctors are beginning to understand that COVID is multifaceted, systematic disorder.
Emerging scientific data now shows that reasons for brain fogging as well as neuropsychological manifestations of COVID have led to people suffering from long COVID for several months. As more such studies emerge, it will be known soon that influenza is not what COVID is all about, and it is ultimately a multi-systemic disorder infecting the whole human body. With Pawan Kumar, Milan Sharma for India Today.